What I do, I'm a psychologist, and I've been involved for quite some years in doing risk assessments and working with a difficult population that often gets confronted in the criminal justice system. The behaviors get acknowledged, sometimes lead to prosecution, but at the very least, they're risky behaviors as far as a community standpoint. Often with these issues comes health and safety topics that we need to discuss, both from the client's perspective and from the community's perspective. And these often force us to look at some kind of temporary restriction that we need to do to try to help the person better relate to the community. What we need to talk about, though, and I'm going to mention several things, is we need to not just place restrictions on clients, because that gets into serious rights violations, but we need to make sure we're teaching clients alternative behaviors that are going to lower risk, and that we're also using the least restrictive measure and as a last resort when there's any temporary restriction placed on behaviors. What's my view of rights? Well, I think from a treatment standpoint in the community, and looking at a residential perspective, people living in the community, we also need to look at responsibilities, because they do coexist with rights. We have to be a responsible citizen if we're going to have free access to community resources. Very important. Individuals' rights always need to be upheld and treated with dignity and respect. But as part of this, we need to involve clients in the planning process, especially when there's any temporary restrictions placed on behavior. They need to be part of the meetings. They need to be part of the planning, because they need to ultimately take responsibility for outcomes. How do we make sure that we're protecting everybody's rights that are considered? I think one of the things that I've started seeing more happen across the state, which is very good, is more risk assessment has taken place for our individuals. That's extremely important. And when I do risk assessments, I always look at all the issues involved in the case. What do I mean by that? Too often we look at sexual offending. Does somebody have sexual risk issues? And that's important. But we also need to look at other issues when it comes to a client, such as, do they have serious aggressive issues that could impact the community? Do they have boundary issues that could put themselves or somebody else at jeopardy? Do they have arson issues? And more what I'm seeing across the state is substance abuse issues that haven't been treated for many, many years. So we have to make sure when we're doing a risk assessment that we look at all areas of risk that could impact the community and impact that individual. I want to make a few other statements. When we talk about restrictions, because that can be a nasty word, I want to make sure that we're talking about things in context. If there is a restriction that's temporary placed on a client, it needs to be a last resort. And we have to make sure we've looked at other approaches to address the problem before, as a team, we put any restriction on a client. Second, we need to make sure that the client's been taught individual skills that might make any type of restrictions unnecessary. Often we don't think outside the box as a team and look at what creative things can we put in place treatment-wise for a client that might negate us having to do any type of restriction. Third, if we are going to put any type of restriction on a client, it needs to be supported by data, that it makes common sense temporarily for protection to have it in place, but that data supports it's needed. Next, any restriction we place on a client needs to be part of a behavior support plan. And that plan needs to be well thought out by some professional that understands the individual needs of that individual in depth. Next, we need to make sure that the behavior support plan includes teaching of skills that will eliminate any type of restriction. Too often we don't think enough educationally of teaching, and our clients, we need to make sure we're giving them the resources and the teaching steps that they can be successful. And then finally, any type of restriction that's ever in a behavior support plan needs to have a fading component. We need to show that we are trying to plan progressively to fade any restriction so the person has total access back to the community. This can be sticky when we're talking about sex offending. But I want to kind of end in just discussing community safety, because I'm in community corrections, and I realize how vital it is that we keep the community safe, because our perception by the community really can limit access of our individuals to the community. So we want to make sure that we're putting plans in place that make sense to keep the person's rights intact, but also to make sure community safety is paramount. Because when we forget about community safety, we really put our clients at risk for losing access to the community, to jobs, to residential placements, etc. So it's extremely important that we think of community safety when we're developing our plans. So that's kind of my presentation.